This is critical thinking in the circulation and cardiovascular physiology lab. And let's look at some of the questions here. So the first few are on circulation. So this is fetal circulation. This question is on fetal circulation, and these are the choices. The next one again on circulation, where you have to identify a vessel and then say what is it a branch of. Then again, identify, you have to talk of two vessels which drain into this one. Here again is a bit of circulation and physiology, where you identify the vessel and then say what would happen if there was atherosclerosis. And this is on physiology, something to do with cardiac output. And here again on physiology, and this takes into account the cardiac cycle. So if you notice, cardiac cycle is really important. So let's come back here, and then it asks you what kind of blood is carried in blood vessel A, and A, which you see up here, is the ductus venosus. So it's the ductus venosus which connects two veins, and you can see that it is bringing blood from the placenta. And what this ductus venosus does is it connects the umbilical vein with the inferior vena cava, and this carries oxygenated blood, because remember, the umbilical vein is, this one is the umbilical vein. The umbilical vein is different from other veins in the body because it's carrying oxygenated blood. So it's very similar to the pulmonary vein. And here, this portion here, this bit here, is where the ductus venosus connects the umbilical vein to the inferior vena cava. So that also, therefore, will carry oxygenated blood. Once it goes into the inferior vena cava, then the blood is mixed. So inferior vena cava carries both oxygenated and deoxygenated. So now let's look at the next picture, where look at the clues given. It says identify the vessel the arrow points to, and then it says what is it a branch of. Now whenever you get something like that, where it asks you what is it a branch of, automatically you should know that it's an artery. Arteries have branches, veins have tributaries, or the word used will be what does this vessel drain into. Secondly, arteries are always colored red, other than maybe pulmonary artery and the umbilical artery, where some images might have them blue because they carry deoxygenated blood. So let's look at this and see where the vessel is going. So if you look at this image carefully, this is the liver, and this is one of the images from the image database that you're supposed to look at. This is the spleen. These are the kidneys. So this artery is the aorta, and here are the branches which come off the aorta. So this one here is the celiac axis, and the arrow is hiding it. Up here is the superior mesenteric, and down here is the inferior mesenteric. This artery is going towards the liver, as you can see. So I'm going to remove this. And now, if you look at it, the artery is going towards the liver. So this is the hepatic artery. And what is it a branch of? The hepatic artery is a branch of the celiac axis. So therefore, this is the correct answer. Now, if you thought of first of all, this one can completely be taken off the choices because it's a vein. And remember what I said about branch and vessel. So now, splenic artery should go to the spleen, but you know the spleen is on the left side and this is the right side. So this is the liver. So that's how you should be able to choose your answers. It can't be the celiac axis because you can see that the vessel is pointing to something which is going to this organ. So therefore, it's a branch of the celiac axis. Let's look at the next question. So again, here it's pointing to a vessel which doesn't ask you to identify. So you have to read the question carefully, but it just says name two blood vessels that drain into this vessel. So first, that means that this is a vein. So anything that drains into it will be a vein. So first in your mind, you must identify what this blood vessel is, and then you will have the answer. So this is the inferior vena cava. And even if you forget, right here itself, you can see, look at this. This is from the kidneys. You can see the renal veins going into it. Here, this is the suprarenal on this side. So the suprarenal on the right side drains into it. These vessels which go up like this, these are the gonadal veins. We don't know the sex, so we call it gonadal veins. And then here, of course, you have the common ilia. So, any of those would be choices. Now, in your lab test, of course, you would have to write those down. So that's the way to look at it. But look up here. So it says splenic vein and renal vein. Remember, splenic vein drains into the portal vein. So this is not it. And you can see that you don't see the splenic vein up here. Then inferior vena cava. The vessel is the inferior vena cava. So this is not the choice. This one, it says artery. So obviously, you can discount this. The last one where it says renal vein and common iliac vein. So that is the correct answer. So this one here is the correct answer. So this is the correct choice. Now let's look at the next question. We're looking at this question where it asks you to identify the blood vessel, and then there's a secondary part to it, which is physiology. What would be the result if there was atherosclerosis in this vessel? So first, the blood vessel that you're looking at, notice this vessel here. This is the thoracic aorta. This is the thoracic region. So this is the thoracic aorta. So let's look at the choices right here. Arch of aorta, so naturally it's not this one. Abdominal aorta, no. The abdominal aorta would be way down here in the abdomen, and we saw one of the previous slides which had that. Thoracic aorta, so obviously we can think of this choice, and if it was just aorta, so possibly, let's say, so we'll keep that in mind too. Now, always when you get vessels, if there's something like thoracic aorta or abdominal aorta, it's always better to write the exact identification if you know it. For example, if you know that this is thoracic aorta, write it. But if you don't know and you just write aorta, that's fine. Don't make a mistake, because if you identify this as abdominal aorta, then it becomes wrong. Okay, then it says, what would be the result if there was atherosclerosis in this blood vessel? So remember, we are looking at just these two choices. These are wrong. So therefore, you should still look at these choices. If there was atherosclerosis, that means the heart rate will not increase, because atherosclerosis has nothing to do with heart rate. Heart rate won't increase. Neither would stroke volume increase, because heart rate and stroke volume, which determine cardiac output, have no relation to a blood vessel being narrowed like this. So if this is the blood vessel and there is atherosclerosis up here, it's not going to affect heart rate or stroke volume in any fashion. That is going to be affected by increased contractility, or by action of the sympathetic nervous system, or by end diastolic volume and so on. What will this do? Because the vessel is so narrow, blood will flow through it, but there will be a greater resistance. So that resistance is known as peripheral resistance. So that would increase. So wherever possible, you must always use words that you have been taught. So you know that when we are discussing blood pressure, we talk of peripheral resistance and we talk of cardiac output. So that's what happens. In old people, very often when they get old, the blood vessels harden. There may be atheromatous plaques, and they have atherosclerosis in them. And that's why they have high blood pressure. And the reason why they have high blood pressure is because the peripheral resistance increases in these people. So that is the correct answer. And then you think of this, blood would become more viscous. That means blood becomes thick. That won't happen. Just because there's a plaque and narrowing of the vessel, that has no reason to make the blood more viscous. So this again is not a choice. So therefore, this is the correct answer. Let's look at this question. So here it talks about this person who's an athlete, who's a tennis player who trains for 6 hours. So obviously daily training, so that person is an athlete. Athlete, in his case, his stroke volume is more than that of a sedentary person. So that is very true of athletes. They have higher stroke volumes. And then it asks you, what do you think his heart rate will be compared to a sedentary person? So now we know that stroke volume times heart rate is equal to cardiac output. So if someone's stroke volume is more, to maintain the cardiac output, then their heart rate will be lower. So then if this is low, this becomes high, and that maintains this cardiac output. And that is what happens in athletes. Athletes have a lower heart rate. So this is the right answer. And actually the reason for the lower heart rate is because athletes have a very active parasympathetic system. And this is what they have, what is called a high vagal tone. The vagus, which carries the parasympathetic fibers, it is very, very active. So they have a high vagal tone, and the parasympathetic nervous system decreases the heart rate. Because their heart rate is low, what happens is it allows the ventricles to relax for a longer time, so they fill with more blood. So therefore, that when they fill with more blood, the end diastolic volume is more, so they can push out more blood with every beat. So therefore, their stroke volume is higher. So because athletes have a high vagal tone, they have a lower heart rate. They compensate for this in order to maintain cardiac output. They compensate for this by having a higher stroke volume, and that's how they maintain their cardiac output. And then let's look at this question. So here it's again on cardiac cycle. It asks you what would be the effect on the heart if the aortic valve did not close properly at the end of systole. So normally at the end of systole, the aortic valve should close because you don't want blood to come back from the, so again, if we draw the heart this way, and this is the aortic valve here, and this is the aorta coming out from the left ventricle. So it should close so that you don't want blood to come back into the left ventricular chamber. So what will happen if it does not close? So blood will come back into the left ventricular chamber, and it would have more blood than normal, because blood will come back from the aorta, and in any case it's going to receive blood from the mitral valve too, from the left atrium through the mitral valve. That blood will come too. So now it's going to have more blood than normal, so the left ventricle will dilate. So therefore, this is a possible choice. So, the heart will not shrink. The neck veins won't get engorged, because that is to do with the right side of the heart. And, you cannot write answers like this, the body would suffer. So it's not this one. So the left ventricle would dilate. So that is right. Then it says, what would be the effect if this valve was stenosed? So now, if the aortic valve was stenosed, that means it's narrow, the left ventricle has to work really hard in order to push blood out through this valve. When it works really hard, its muscle begins to get hypertrophy. So this left ventricular chamber would hypertrophy, and that is what this answer says. So therefore, this is the right answer. So you can see how you should you need to know the cardiac cycle and how you need to work out the correct answer. This also gives you an idea how you should answer in your test, because you can't write things like body will suffer, heart has to work harder. Instead, you have to write it in proper terms, such as the left ventricle would hypertrophy, or like peripheral resistance, for example, in the previous answer, like I said, peripheral resistance would increase. So you have to use those terms. So this finishes this critical thinking video.